What's going on, y'all? My name is Unu, and I tore my ACL in my right knee, so that's why I'm wearing this brace here. Now, I've had similar injuries or the same injuries in my left knee, and these happened over a decade ago when I was a lot younger. And when I was rehabbing my left knee, I was told at the time and had read things at the time that said the ACL or anterior cruciate ligament doesn't have enough blood flow, and so it doesn't heal on its own. And so in order to get back to playing sports, especially at a high level, you have to get surgery. So I went through that process. I've actually had multiple surgeries for this injury in my left knee because many of them failed. And so I finally found the right surgeon to do a newer method, and what he called it was the anatomical surgery method. And I used the patellar tendon on this last go, and it has been successful. I haven't had any problems with my left knee since. Now, more recently, on September 14th of 2024, I was playing soccer again, and I got kicked in my lower leg, and I felt my knee pop. And I ended up getting an MRI, and it showed that the ACL in my right knee is completely torn. Now, the good news is that my meniscus or any of the other ligaments aren't compromised, so it's just an ACL tear. And while it really sucks to kind of go through this injury again, I want to document my journey. You know, I've read new research that says that the ACL can regrow, and I've seen videos of small blood vessels on this ACL. So I wanted to document my journey to see if I can rehab using myofascial release as well as physical therapy. I actually became a physical therapist because of my left knee injuries, and so at this chapter in my life, I'm opting not to rush out and go get surgery. I don't have any pressure to get back to playing any sports at a high level, so I want to take it easy, do things smart, be patient, and see if I can be part of this population that can show that your ACL can regrow. Now, something that I'll be using as guidance is a cross bracing protocol, and I like that it has shown that the ACL can regrow. In this particular study, I'll quote this later, I'll show this later, but out of 80 participants who had a completely torn ACL, after 3 months following this protocol, that 90% of them had shown that the ACL had regrown at least a little bit. And so I'm using this cross bracing protocol as guidance, but I'm also going to modify it because I don't want to follow it to the same T for my own personal beliefs. Now, I know that in the beginning, it's going through its healing phase. And so what they recommend in this cross bracing protocol is to put yourself in a locked 90-degree brace and to do no weight bearing. So you're non-weight bearing. And this is to protect your knee as it is regrowing and healing. And while, yes, I understand you don't want to do anything to compromise this healing phase, which is very important, I believe that your body is supposed to move. And so I don't want to just make it sit idle and lock it in 90 degrees for the full months. I've given it a little bit of wiggle room right here. So it's actually locked from 80 to 90. So I have this 10 degrees of mobility or knee flexion and extension. And that allows me just to move it a little bit. And I think that helps pump, whether it be certain fluids out. I had a pretty severe ankle injury as well. And I know that moving my ankle and things like that helps to pump the fluid out versus just keeping it locked here. Now, obviously, if you're going to follow this protocol, they say lock it in 90 degrees for the first 4 weeks or the first month. But because I just want to move it around a little bit and it's a small amount, that's what I'm going with. And so whether you choose to follow me or follow the protocol to a T, that is one thing that I've done. Now, something I wanted to shed some education on are crutches. So crutches definitely kind of are sucky to use, but for where I'm at, I think it's something that is absolutely necessary. And so as a physical therapist, there's a certain way you want to size your crutches. And I'm a little bit out of frame, but the way you want to size your crutches is you want the armpits not to go all the way up into your armpits to where you're leaning on it like that. You can kind of compress some nerves in that area, and that can cause some irritations. But if you're just standing upright comfortably, you want it to be just below that armpit, okay? So that's the first thing. The second thing is where your handles are is if you relax your arm, you want it to cross at your wrist. And so if you are sizing your crutches and you don't know how to do that, and maybe you're just reading, hey, I'm this height, and I'm just gonna adjust it to that height, that isn't gonna give you the best fit because everyone's a little bit different. And so just make sure that if you are using crutches, that you make sure that it's not all the way up in the armpit. You have a little bit of wiggle room or some space under your armpit. And then if your arms are dropping by you, relax that it goes to your wrist. And so when you're using crutches, you're not putting all the pressure on your armpits. You're actually holding yourself up with these handles, and then you're kind of scooting around. And then the last thing I wanted to teach was about stairs, because stairs or steps can be a little bit cumbersome, especially if you're on crutches. And something that you can do, or something that I have learned, is an easy way to remember it is good people go to heaven and bad people go to hell. And all that means is you want to go up the stairs with your good leg and then down your stairs with your bad leg. And you're always gonna lead with the crutches on the bad leg or the injured leg. And that will just help you navigate steps and stairs more easily and definitely more safely. So I'll just give you an example, that's why I'm here. So if I step up here, and I use these stairs, or I have to get up these stairs, I'm gonna go up with my good leg, readjust the crutches, up with the good leg first. And if I'm going down the stairs, I'm gonna go down with the crutches first or the bad leg first, like so. So that's how you're going to use your crutches, and that's all I've got for this video. Follow along in my journey as I rehab this ACL on my own, and I'll be sharing my journey, my thoughts, and my experiences.